Andrew, folate keeps showing up as the rare supplement with a prevention story strong enough for public health campaigns. Before we talk bottles and brands, is the neural tube evidence actually that decisive? Or is pregnancy just the emotional hook that makes vitamin B9 feel more important than it is?
The pregnancy case is decisive in a way most supplements never reach. Folate is required for DNA synthesis, methylation chemistry, and red blood cell formation. The standout clinical payoff is folic acid before conception and in early pregnancy, which lowers neural tube defect risk, including conditions such as spina bifida. That is time prevention, not a vague energy claim.
So, what is the body actually doing with this vitamin in those first weeks? Walk me through the mechanism without turning it into a biochemistry textbook that loses people halfway.
Think one-carbon metabolism. Folate helps cells copy DNA cleanly while tissues grow fast, and it partners with vitamin B12 in the same pathway. In early pregnancy, adequate folic acid supports neural tube closure, the embryonic structure that becomes the brain and spinal cord, before many people even miss a period. That timing is why guidance aims at the periconceptional window, not only the second trimester prenatal visit. Folate from food still matters, but the prevention playbook relies on folic acid from supplements and fortified grains because those doses are measurable, stable, and reproducible across populations who need coverage before a positive test.
Internet clips fight over folate versus folic acid like one is natural virtue and the other is a fake twin. Are viewers right to treat those labels as enemies, or is that mostly branding theater dressed up as science?
They are related forms of vitamin B9. Folate is the natural family in dark leafy greens, legumes, and citrus. Folic acid is the stable synthetic form in supplements and fortified breads, cereals, flours, pasta, and rice. Your body uses both. Water-soluble leftovers leave in urine, so you need a regular supply rather than a one-time megadose mentality from a single weekend cleanse.
If fortified cereal already has folic acid, why not just eat more toast and skip the pill? Or go the other way and megadose a high-potency bottle every morning just in case pregnancy might happen someday?
Food alone is an unreliable prevention plan for people who could become pregnant. Standard advice is at least 400 micrograms of supplemental folic acid daily for women of childbearing age, with pregnancy targets around 600 and clinician-guided higher amounts for twins or prior neural tube-affected pregnancy. Casually clearing 1,000 micrograms a day from supplements plus fortified foods is the usual ceiling to avoid without medical direction.
Separate from pregnancy planning, when does folate supplementation actually fix something measurable in blood rather than just sounding virtuous on a label next to biotin and greens powders?
Correcting folate-deficiency anemia is well established. Folate helps form red blood cells, and deficiency can show up with fatigue-linked anemia, plus clues like mouth ulcers, poor growth signals, or a swollen tongue. That is repletion medicine, proof you were low, not evidence that extra folic acid upgrades already normal blood counts into super blood for healthy adults. Homocysteine is the seductive side plot. Folate helps remethylate homocysteine, so blood levels often fall with supplementation. A 2026 meta-analysis in coronary disease found combined B vitamins lowered homocysteine and reduced restenosis risk. Yet major cardiovascular events and cardiovascular mortality did not clearly improve. Marker down, hard outcomes still unsettled for everyday heart protection claims.
Then, what is the B12 masking warning I keep hearing? How can a helpful B vitamin hide a dangerous deficiency instead of fixing the whole problem cleanly?
Because folate and B12 share the one-carbon pathway, high folic acid can improve the anemia pattern of B12 deficiency while nerve damage continues underneath. That delayed diagnosis is the core caution. Unexplained anemia or neurological symptoms need clinical evaluation, not another unsupervised high-dose B9 tablet from the internet aisle.
Do food pattern studies change the picture, like plant-heavy diets raising serum folate, or is the prenatal pill still doing all the real prevention work on its own regardless of dinner?
Diet can move the needle. In the Direct Plus trial, A green Mediterranean pattern with Mankey raised serum folate more than a standard Mediterranean or guideline diet over 18 months. An MTHFR genotype shaped the response. That supports food quality. It does not replace periconceptional folic acid for neural tube prevention. Separately, a 6-month B9 and B12 cornflower fortification trial in teenage girls did not improve primary cognitive scores, so Brain Boost marketing stays ahead of that particular evidence. High-dose self-experimentation also collides with medicines and medical history. People on methotrexate, some anti-seizure medicines, or with a cancer history need clinician direction before pushing folic acid hard. A systematic review of excess folic acid in the preconception and pregnancy window has also flagged signals, such as gestational diabetes associations, which is another reason more is not automatically safer for every pregnancy.
If someone starts a prenatal or folic acid tablet, what should they use as proof it is helping? Subjective energy, blood work changes, or simply knowing they covered the early prevention window before closure finished?
For neural tube prevention, success is largely invisible. You cover the early window before closure finishes. For deficiency, look to clinician-ordered blood counts and folate status, plus symptom resolution over weeks. Fertility clinic data show female multivitamin use associated with higher live birth chance in one secondary analysis, but folic acid alone was not a clear live birth driver there. So do not overread single ingredient bottle marketing as fertility magic. Keep the hierarchy clean. Strongest use: folic acid before and during early pregnancy for neural tube protection, plus treating true folate deficiency anemia. Useful secondary fact: homocysteine can fall with B vitamins. Weakest sleep: assuming heart attacks or sharper cognition will follow every B9 pill. Match the dose to the goal. Keep vitamin B12 in the same conversation whenever doses climb, and let a clinician settle unexplained symptoms.